We good, James? All right, everybody. Welcome to today's Team Kentucky update. As has been the case the last several updates, we're going to start discussing the Delta variant, where we are. Then we're going to share some good news out there, good economic news that we continue to see. But let's start with the Delta variant. It is very real. It is causing devastation. It is making our hospitals overflow, and it is taking the lives of our people. Yesterday, we were able to confirm the death of a 15-year-old Kentucky student. That is now our second student that we have lost in the midst of this pandemic. We've lost at least 2 students, 2 bus drivers, multiple coaches, multiple educators. This is a very serious variant of this virus that is impacting more and more young people. So whether you're in your 20s or whether you're in your teens, please understand that with this variant, you are not immune, and it can and it will cause you serious illness and serious harm. Everybody's got to understand that they are at risk, if not for their own personal health, of ultimately spreading it to others whose bodies cannot handle it. And we cannot handle more sick individuals as our hospitals are at such a critical point. As of today, 60 of our 96 hospitals are reporting critical staffing shortages. And as of today, we have the fewest available ICU beds than at any point in this pandemic, with only 90 adult ICU beds available statewide. That is the lowest number that I can remember seeing during the course of this pandemic. We see hospitals that are overflowing so much they have to request very basic supplies that otherwise wouldn't be needed. Baptist Health Hardin requesting 25 beds, mattresses, and IV poles because they are opening additional inpatient beds in places in the hospital where they've never been. In other words, taking rooms that were never meant for hospital patients and having so many people in the area that need to be hospitalized, they've got to bring in more beds, more mattresses. Pineville Community Health Center, just the newest area that's requested more ventilators. Pineville is a community health center, but they are taking care of COVID patients in order to alleviate some of the stress from the hospital. In other words, so many people needing a hospital bed. We're now taking care of them at healthcare centers outside of hospitals. So this is just another step, right? We've got regional hospitals treating people that are much sicker than they are ever used to treating. We've got groups that have created ICUs that have never had ICUs before. And now we have community health centers like Pineville Community Health Center. You also have Primary Care Center in Hazard with Barry Martin and his group, also taking care of patients that would otherwise be in ARH Hazard, and also doing monoclonal antibody treatment and direct care. Folks, our hospital situation has never been more dire in my lifetime than it is right now. That means if you get COVID and need to be hospitalized, there has never been a greater likelihood that there's not a bed for you or your family members or your friends. At the same time, it means if you were in a car accident today and you need emergency treatment, that emergency room has never been more full than it is right now. But there are things that we can do about that to make sure your family member has a bed, to make sure that you can get help if you were in that car accident. That is number 1, get vaccinated. And number 2, wear a mask, right? The number of people who are infected can directly be reduced by masking. That'll mean there are fewer people infected, therefore fewer that need hospitalization, fewer that need to be in the ICU, fewer that need a ventilator. So please do your part. When we look at the line graphs, which we did not do on Tuesday, there was a hope at one point as we'd looked at our inpatient census for hospitals that we might be cresting, but that line continues to go up in an exponential curve. This is one where we can't simply look to the south or other places and say we think it's beginning to slow down. It is continuing to tax our hospitals at record rates, and the growth is not sustainable. We look at the intensive care unit, the same thing. Again, the fewest number of available intensive care beds I think that we have had in the last 40 plus years. And this is with hospitals creating new ICU beds every day, doing their very best to try to ultimately open them up. But when you have a record number of Kentuckians hospitalized and in the ICU, this is what happens. And then there's Kentuckians on a ventilator. Now, again, continues to generally rise. This is when you can't breathe on your own. And we got people of all ages. I think we're going to have a 21-year-old in our next report having passed away. We have younger people on ventilators than we ever thought we'd see. People who are healthy, no pre-existing conditions. The COVID hits them so hard they cannot breathe. And if they are lucky enough to recover, it's going to come with long-term complications. So again, we need everybody to do their part. With hospitals hit as hard as they have been, we are taking every step that we can to free up more of their clinicians so that we can take care of more people. We're going to go over the different steps that we're taking and additional steps that we have taken. Let's start with our National Guard. With record hospitalization and patients in critical care, our hospitals continue to face unprecedented challenges from the surge of the Delta variant, and we have to do everything we can to support them. We've been working around the clock to assist hospitals and healthcare systems respond and ultimately free up staff. To date, we have deployed Kentucky National Guard to assist our hospitals and healthcare heroes in 4 locations: St. Clair, hardest hit hospital in the state, ARC Hazard, Med Center Bowling Green, and Pikeville Medical Center. Those have provided logistical support in each of those areas, and they have been greatly appreciated. I've heard from CEOs from 2 of these areas, and they could not be more grateful for the great support from the National Guard and tell us it is making a difference. But there are more than 4 hospitals that have been hit and hit hard. So today, I'm announcing that along with the 4 hospitals that already have National Guard teams on the ground at their facilities, we're deploying, and I've authorized the deployment of an additional 310 soldiers and airmen that will be going to assist 21 more hospitals. They will assist with non-clinical functions within the hospitals for a maximum of 2 weeks. 10 to 30 members will be deployed to each facility next week. They are helping again with the logistical and administrative support to allow hospital staff to focus on patient care. The additional 21 hospitals, we can put up the list now, are TJ Sampson in Glasgow, Taylor Regional in Campbellsville, Ohio County Hospital, Hartford, Manchester Hospital, that's Advent in Manchester, CHI St. Joe in London, Baptist Health Louisville, Baptist Health E-Town, Baptist Health Corbin, Baptist Health Paducah, Baptist Health Lexington, Highlands ARH, that's what I meant earlier, I meant Hazard, ARH Hazard, in Prestonsburg, Tug Valley ARH in South Williamson, Middlesboro ARH, Harlan ARH, Mercy Health Lord's Hospital in Paducah, U of L Hospital in Louisville, TriStar Greenview Regional Hospital in Bowling Green, Rockcastle Regional Hospital, Mount Vernon, Lake Cumberland Regional Hospital, Somerset, Kentucky River Medical Center, Jackson, and St. Elizabeth Covington Hospital. Listen, this shows that every hospital is bursting at the seams, that they desperately need help, and that we are a state full of more seriously sick people than we have ever seen. So we've got to have everybody wake up. Now, there were too many stories of folks as they're about to be intubated saying, can I take the vaccine now? The answer is no. And we hope that you're going to get off that ventilator as opposed to the other alternative. If you love your region, if you love your neighborhood, if you love your neighbors, if you love the people in the community you live around, we need you to get vaccinated. We need you to wear a mask because your community hospital can't treat that next one of your neighbors that needs help without your help. There will now be 411 members of the Guard in 25 hospitals helping to expand their capacity and ability to respond to this dangerous surge. I believe that this is the largest deployment of the Guard in this type of healthcare crisis situation that we have seen in our history. But you know, they're up for it. Every step of the way in this pandemic, they've been there. They've helped us with testing, administering the vaccine, assisting with food banks, securing the state and U.S. capitals during threats, and now working alongside our healthcare heroes. Every time we've asked, they have stepped up, they have served us so proudly, and they've done a phenomenal job and picked up the morale everywhere they have gone. I believe we have the best National Guard in the country, and they have certainly shown how incredible they are and how seriously they take protecting our Commonwealth. So today, to speak on behalf of the Kentucky National Guard, we have Brigadier General Brian Howay. General. Thank you.
Thank you, Mr. Governor. So with this new spike in COVID-19 overwhelming our hospitals, we've determined, in conjunction with Health and Family Services, that additional Guard support was required. And so starting Monday, as the governor announced, we'll be sending in 310 additional Army and Air folks to 21 additional hospitals, taking us over 400 Guardsmen total and 25 locations in this mission. And like the governor said, we will be providing non-clinical logistics and administrative support so that we can free staff to focus more on patient care. And our mission is geared towards assisting these hospitals through this current surge. And we still have the ability to shift and adjust our resources depending on where the greatest need is. And as you can imagine, with all the things that are going on right now, supporting this mission does bring about an impact to our soldiers and airmen. But we are so honored to be serving with our healthcare heroes who have been on the front lines of this craziness for so many months now. And our mission, while it's temporary, I think it only serves to highlight the importance of all the preventive measures that the governor and everyone speaks up of here, especially getting vaccinated. And of course, today, you know, the governor asked us to come up here and speak, but I don't want the focus to be on the Guard. Of course, I think our focus is on those people recovering and everything we can do. So, thank you, Governor.
I think the General made a really good point that every time we call up the Guard, we ask people to leave their families and their occupation. I mean, these are folks that are in our communities, are our neighbors, and we're asking them to answer the call once again. One question that I don't think we have gotten that we addressed on the front end, but I want to reiterate, is the reason that the Guard is doing non-clinical support is the Guardsmen and women that serve as doctors, that serve as nurses, are already in hospitals all the way around the Commonwealth. And just like every other step we're taking, we wanted to make sure from the very beginning that we were not taking licensed medical personnel away from our hospitals that are suffering so much. Again, our Guard is a great credit to the Commonwealth. You're always there in times of need. Thank you for stepping up once again. If we go back to our 4-point list of things we are doing to help, the FEMA EMS strike teams. I think we're now up to 5 EMS strike teams across the state. We've even repositioned one of them to ensure we're making the maximum difference. These are areas where we can do patient transport so that the EMS that would otherwise do that in that county can respond to emergencies. It's also helping to respond to emergencies in places where the existing personnel is too taxed. We also, over last weekend, thank God, got our first medical strike team from the federal government. They're operating in St. Clair. We showed a video on Tuesday about how much that is truly helping. FEMA is looking at one other potential hospital site right now, but continues to update their analysis. Obviously, it's a hard time with the hurricane and everything that has happened in Louisiana and surrounding states. So we greatly appreciate these strike teams and believe that we've been treated as well as anybody else out there that is making these requests. COVID-19 testing. This has been another way that we've been able to free up hospital staff. So when after the vaccines came in and we saw that last surge eliminated, we saw a plunge in cases. Certainly we were down to significantly fewer people being tested on any given day. Now, the number of people that we used to test in a month, we're testing in less than a week. Demand's picked up, I think, about 10 times, and far too many people are going to hospitals, to ERs to get those tests. So our goal has been to, using our private contracts, our contracts with other testing groups out there, set up in the hardest hit areas to divert people from the ER, sometimes even setting up at the hospital itself. This has freed up multiple clinicians that can then ultimately help patients that are in their beds. So 3 additional new sites with our original testing partner, Gravity, who helped us when we didn't have other labs other than our state lab here in Kentucky, and has experienced incredible growth, was going in many different directions, but knows that this is their calling to help. It's a really special group setting up in Covington, in Danville, and in Pineville. Again, Danville, don't go to Ephraim McDowell to get tested. They have so many patients, and they need to take care of those patients. Go to this or the other testing facility that we set up. All right, let's go back to our list. So we've talked about 3. We've talked about the Guard, which we're so proud of. We talked about FEMA, which we're so grateful for. We've talked about testing and how that frees folks up. But there is another group that has stepped up, knowing we are truly at war, and deployed an army of up-and-coming healthcare practitioners, and those are our nursing schools. We had Galen up a few days ago. And in fact, they have reached out to even more facilities, now getting out to community health and other areas, and we thank them. But today, we're joined by another one of our great nursing programs that has stepped up and, again, is deploying their students, knowing that at this time we must have them. And so we're joined by Brett Weber, Vice President and Chief Operations Officer at ATA College. Brett and his team at ATA are hearing directly from hospitals, healthcare providers, and long-term care facilities, which also need more help. They're hearing about the capacity and staffing shortages caused by the dangerous surge of the variant. ATA is stepping up by sending 40 nursing students out to support teams at Kindred in Louisville, Isaiah House in Willisburg, and Signature Healthcare locations throughout the Commonwealth. So before I pass it over, I want to say thank you. Thank you to you personally. Thank you to your entire organization. Thank you to your students. Thank you for recognizing the gravity of the situation we're in, but also embracing the incredible role that you all can play.
Good afternoon. Thank you for allowing us to speak today. I'm very glad to be here. ATA College is an allied health school in Louisville, and we have been working with a number of hospitals and nursing homes and healthcare facilities in the area to provide support during the pandemic, just as the governor mentioned. Our students have been able to gain valuable knowledge and real-world experience by providing direct patient care at these facilities. As he mentioned, Kindred Hospital, the Isaiah House, and several Signature Healthcare locations in the area. Not only are our students helping with the shortage that exists at these facilities by providing direct patient care, but they're also being prepared for long-term careers in the healthcare field. And there's a dire need for that right now. Many of our students are working in COVID units, directly working with COVID patients. Not only are they helping these patients, but they're learning the specific protocols and care that's required for these patients. It's not an easy job, and I want to thank everyone who's willing to take on that challenge. The shortage in the medical field is real, and our mission is to train and prepare individuals that have a heart to work in the medical field. The state of Kentucky right now has many facilities that they're spending time and money and resources searching for qualified staff. Oftentimes they're having to go out of state and pay higher wages just to fill the basic needs at these facilities. There is great need for nurses, medical assistants, medical coders, and all types of medical professionals in the state right now. I would ask anyone that has a heart for service to consider a career in the healthcare profession. It's rewarded, it's respectable, it's a very secure job, and it's a great opportunity to serve fellow Kentuckians. ATA College, we stand with the governor's office, and we're here to support medical facilities that need help. We will continue to do that. Our goal is to prepare students for a profession in the medical field, and hopefully they will make a difference and help improve the overall health of Kentuckians everywhere. Thank you very much.
Again, we greatly appreciate ATA for both what they're doing in this surge, and he's 100% right. We were 6,000 nurses short before this pandemic occurred, and you can bet this is something that we are going to and must address moving forward. When you talk about average wages when you do it across of $50,000 in many instances, and the fact that we have thousands of openings in Eastern Kentucky, this is something that we absolutely have to address. As we talk about how these cases are surging through Kentucky, we've talked a lot about the age breakdown on who is getting infected. The highest incident rate has been 10 to 19-year-olds every day for weeks. In other words, more 10 to 19-year-olds getting COVID compared to their portion of the population than any other age group. And then it's 20 to 29-year-olds. It's that next area. But it's not just younger people that are ultimately getting COVID, but the overall percent of even deaths, the worst of the worst outcome, have changed pretty dramatically from previous surges. So when we look at pre-Delta, we look at the original strain and we look at Alpha, we went through a tough time. We're almost 75% of folks dying were over 70. This is when our nursing homes, our assisted living facilities, our veterans' homes experienced incredible tragedy, and a whole lot of people lost their parents and their grandparents. And then we saw a percentage of folks 50 to 69. And then after that, you know, people would notice that we didn't lose too many younger people, though every single one we lost, a child of God, and should have never been diminished by anybody. But look at the difference now. You know, if you're 70 and older, you're most at risk to anything that's going around. But the amount that it's been cut, because this is the most vaccinated part of our population, has been incredible. And what has happened? The unvaccinated portion of 50 to 69-year-olds has led to a large increase in the amount of deaths that age group makes up, now almost 40%. Look at 30 to 49. This was 3%. 3% of deaths in the original two, the Alpha and the original strain. Now it's up to over 11, almost a fourfold increase. And guess what? 80 to 29 statistically couldn't even get on the first graph. And look at it now. And this is only going to grow. I mean, yesterday's 15-year-old, and today or tomorrow's 21-year-old. We're seeing it more and more and more. And the answer is pretty easy. Vaccines. Vaccines are available everywhere. You can get one today. You need it to protect yourself. And as of today, 2,587,406 Kentuckians have gotten at least their first shot of hope. Today, we'll just look at it demographically. We're now 70%. This is of adults in Kentucky. These are people who can make their own decision, because you hear lots of stories about decisions made for folks under 18. We're excited to reach that level, but the Delta variant requires more than 70% if we're going to beat this thing. 65 and up has stayed even at 86. Again, no, it's gone up one to 86. Every point this goes up is one that we fight for, but it's one that is absolutely critical, because the remaining 14% of individuals in this age group are the most at risk. Second most at risk are the unvaccinated 50 to 64-year-olds, still at 72%. 40 to 49-year-olds up 1 point to 60%. 30 to 39-year-olds, again, that's where we're starting to see that new graph at 55%, no movement. 18 to 29-year-olds, come on. This thing is dangerous enough, and you can spread it to other people. Surely more than half of 18 to 29-year-olds believe they've got a responsibility to the people around them. Please go get vaccinated. 12 to 17-year-olds we will have when we update to the new numbers based on the newest census. All right, and a little bit of incentives. We hear about incentives in the special session. We've been offering them, as has our localities now since December the 15th of last year. But today we get to announce our first round of Vax and Visit Kentucky winners. Vax and Visit KY is the Commonwealth's latest effort to encourage Kentuckians to receive the vaccine by offering in-state travel incentives to Kentuckians who have received the vaccination. Eligible Kentuckians who have received their shot of hope can register a chance to win a staycation at a Kentucky state park. That gets golf, lodging, and campground gift certificates. Shots of Hope continue to be our best resource for saving lives, for keeping our kids in school, and for keeping our economy surging. So our first round of Vax and Visit winners are as follows. Michael James from Flemingsburg, Gladys Hutcherson from Frankfort, Casey Apgar from Erlanger, Alyssa Lipsky from Louisville, Nancy Allen from Monticello, Robert Rippengale from Hodgenville, Debbie Yancey from Monticello. Monticello's cleaning up. Mary McLeod Jones from Louisville, Pamela Campbell from Fort Thomas, and Jason Phillips from Claremont. Congratulations to all of the winners. And for those who did not win today, you can still register and you still can win. Our next drawing takes place on September 20th, with winners announced September 23rd. There's the chance to get a little bit of enjoyment just from doing the right thing. Again, this is the tough transition each time in these updates, because we're experiencing two historic moments all at the same time. One of difficulty and tragedy that is the COVID pandemic. The other is a surge in our economy, the likes of which I don't think that we have ever seen. So there is a lot of good news for the future out there. One piece, earlier this week, I had the pleasure of joining a number of developers, local officials, and company representatives as we broke ground for a new hotel in Louisville's thriving Nulu neighborhood. The hotel will be managed by Bunkhouse Group and become their first property in Kentucky. It's got 122 rooms with an avant-garde style. This new lodging project will create 40-plus quality jobs. The developers, Mountain Shore Properties, along with Kaveh Zamanian, founder of Rabbit Hole Distillery, have done a great job. Scheduled to be open by Derby of 2023. Hotel's planned amenities include an outdoor art gallery and programmable space, a mini mart, a rooftop restaurant, and a bar. It'll also boast a culinary training center for bunkhouse staff, as well as for employees of other hotels. Listen, this shows great promise that's out there. It shows our tourism industry is and will be coming back. It shows, again, how much is going on in our state. We've already seen more than $2.8 billion of new investment in our Commonwealth this year. That's already more than all of last year. I still expect we will more than double it by the end of the year. We have a chance at least to have one of the best economic development years in history, even in the midst of this pandemic. And just think about some of the things we've been able to announce. The operationalizing of Amazon Air in Northern Kentucky with 2,000 new jobs. Pratt Paper in Henderson, cleanest, greenest, most technologically advanced recycled paper mill in the world is going to be built. Biggest project in Western Kentucky in 25 years. 320 new jobs. Fruhoff, semi-trailer manufacturer, 288 new jobs in Bowling Green. Kruger, 150 new jobs in E-Town. Vela North America, new headquarters in Louisville, 75 jobs. Already 75 new jobs in Shelbyville. Firestone, 250 new jobs in Whitley County. Kentuckiana Curb, 700 new jobs in Simpsonville. Metalco, creating 60 new jobs in Franklin. Nucor Tubular Products, just another example of a company connected to Nucor itself, 72 new jobs. And Fidelity in Northern Kentucky, 600 new professional jobs. Listen, we have an economy on fire with hourly wages for these new jobs being the second highest that we have ever seen, because a couple of years back, UPS hired a ton of pilots all at the same time that have a really high wage. So we are incredibly excited. Thank you to Bunkhouse, Rabbit Hole, all the partners in that hotel, but also everybody out there hustling in economic development. The opportunities are huge. With that, I think we can open it up to questions. I'm sure some on the special session as it continues. I'll reserve some comments until we know what we're going to get out of the special session. Today, we have Morgan Watkins here with us in person, and then about 6 on virtually. So, Morgan.
The legislature's proposal to end the mask mandate for schools that KDE has in place, do you know at this point if that falls outside the agenda you set for the special session? And do you have, are you considering taking legal action to keep the mandate in place if the legislature passes the legislation to end it?
You know, I don't think anything is to near that point. I think the language that was used for the call was shared with leadership on both sides who reviewed it, offered 1 or 2 changes, and thus we put it out. If there ends up being disagreement between what is and what isn't in the call, that'll be something that can be discussed, or ultimately, I don't anticipate it would be us. I guess if there's a big enough disagreement, it would end up in court. But this is language that was reviewed by everybody on all sides. That bill isn't through yet. Let me say that I believe universal masking is absolutely necessary in schools. Now, thankfully, I think most superintendents know that now, even the ones who didn't think it was true in the beginning. So again, I think there's different amounts of speculation out there. There's also the question of how many people at this point would be foolish enough, because that's what it would put that many kids in danger by not requiring masking in schools. I know some that voted it out of the committee last night. I think it was the House committee that initially failed. One, in the very least, to see a range, maybe where you hit red or you hit orange, where cases get so big, where different things come directly into play. So we'll see what we get. We'll also see what my ability is on a veto if necessary, and what the options are there. But right now, I focused a whole lot on what we have in common. Obviously, this is the biggest disagreement that's out there. Josh James, WUKY. Should we come back to Josh, or is it an overall? Okay, Stu Johnson, WEKU.
Okay, Governor, thank you very much. On the staffing issue, the term in some of the legislative committee meetings has been used as terms of poaching, where nurses have left Kentucky for other states. To what extent has not really been discussed. Can you lend any light on that subject? And I guess a second question related to that is Senate President Stivers yesterday mentioned that not now, but at some point, he might like to see legislation to require the nursing schools to produce more nurses. Would you favor that?
Well, absolutely. On the second end, our nursing schools can take on more students. They've been limited, whether it's in accreditation or the nursing board, and we need to open that up. You know, we're not providing instruction the same way that we did 20 years ago, and we have so many job openings in Kentucky for secure and absolutely necessary jobs. We absolutely have to give these schools that do such a great job the opportunity to train more students that are out there. You know, I heard a little bit of testimony on when we had to stop elective procedures, that our nurses went other places. It didn't happen then. The president, then President Trump, and Vice President Pence asked every state to stop elective procedures at the same time. And we followed the president's request and recommendation, as did every other state that was out there. Now, what's happened is every state that has gotten short on staff, every hospital has looked out towards staffing companies. These staffing companies start charging ridiculous amounts that I think are wrong, that I think in some instances are gouging to our hospitals. But when they can get that money coming in, they can afford to pay people more. So they go out and hire nurses and others at hospitals at a higher wage, and then send them wherever these folks have contracted. So I don't think we've lost a ton to other states. We've gotten some in from others. What we're seeing is we're seeing poaching on each other. And it's not, for the most part, you know, a Baptist Health hiring from a Norton. It's they both need additional people. The only real option out there is the staffing agencies, and then the staffing agencies go and hire the individuals away from other hospitals. It is not a good situation. I hope that the AG's office at least takes a look at what is being charged. I know a number of hospitals have sent referrals there. It's taken advantage of us in the middle of a crisis. John Boyle, WFPL. Got a lot of public radio today.
Hey, Governor. I wanted to ask you, given what we've been seeing, you mentioned about the hospital situation being worse than it's ever been. What role could the regional field hospitals like we saw earlier in the pandemic play in the current surge we're seeing? And is that even a viable option at this point with some of the staffing issues we have?
You nailed it right on the head. It's not viable because we couldn't staff it. Right now, the people that we would have to take to staff it would come from hospitals or healthcare entities from around the state that are already full. Now, what we can do is we can provide some of the things that we bought to make sure we could stand up a field hospital to different hospitals that are in need. Those can be beds, those can be tents. So everything that we purchased, we've stored and we can use again. But right now, it's not that we don't have more beds, it's that we can't staff more beds. But we are using some of those materials. But the last thing we want to do, and we've worked very strongly with the legislature on this, and they've been very responsive. The last thing we want to do is to take healthcare personnel away from an existing hospital to set something else up. James Pilcher, WKRC Local 12.
Good afternoon, Governor. We're seeing the same kinds of surges in Northern Kentucky that you're seeing statewide. What are your messages to the leaders here, especially those in the legislature, as well as are you seeing any specific hotspots that are worse than others around the state, or is the entire state on fire? Thank you.
Well, the entire state's on fire. I think today we have 117 red counties. It's been 119 or 120 most other days. And as we can see, the cases are not going down. 2 weeks ago to last week, we didn't see as big of an increase, but those were the top 2 weeks for cases, top 2 weeks for hospitalizations, top 2 weeks for people in the ICU, top 2 weeks for people on ventilators. And they're likely to be the deadliest 2 weeks when we find out, a month from now exactly how many deaths occur from from that sickness. To Northern Kentucky, I will say, help's on the way. The National Guard, one of those units is going to be helping out at St. E's in Covington. We'll also work with Gravity on Northern Kentucky testing centers, which I believe we're setting up another one in Covington. Gravity obviously being a Northern Kentucky company. I think Northern Kentucky ought to be very proud of that. We see significant cases, and they move around the state. You know, Bell County and Eastern Kentucky have been hit exceptionally hard and very, very quickly, and it is unrelenting at the moment. But everywhere is on fire. Some places just have more hospital beds than others. If Northern Kentucky, Cincinnati had more regional style healthcare and more rural areas of the state, it would look like the war zone that it looks like in so many other places. You know, the fact that we've had to set up tents outside of Pikeville Medical Center for triage, St. Clair continuing, even with all the help, to just see devastation. The folks we've had to send to Hardin and others delivering ventilators around the state breaks your heart. And the fact that this is all preventable, that people would just be kind enough and empathetic enough to know that wearing a mask and taking a vaccine is bigger than just them. So I hope that we can reach people without them having someone they care about die be the reason that they'll finally do the right thing. We have either Al Cross or Melissa Patrick from Kentucky Health News.
Good afternoon, Governor. Thanks very much. This is a pretty big expansion of National Guard. Is it more likely than not that we will see another expansion of the Guard's help in this crisis?
You know, I think that remains to be seen. You're right. Originally, we had 7 teams, though they were in 4 hospitals. Some needed multiple teams. Originally, the plan was only to have about 7 additional teams, but the need has been so great. This is I think in a healthcare crisis, this is the most significant deployment that we've ever seen. Certainly that I've had to call, and I've probably now called out the Guard more times than just about any governor, at least in recent history. My expectation is, as opposed likely to, and again, this is a bit of, I don't want to call it speculating, but trying to look ahead, I would see it more likely that we move Guard personnel, as the general talked about, as one hospital frees up a little bit more, 2 other area hospitals that are around. Travis Ragsdale, WDRB.
Thanks, Governor. You mentioned those 3 additional testing sites. Is there the potential to add more if the demand is there, or do you think that we are kind of reaching a peak when it comes to testing?
So I don't think we've reached a peak in testing. I believe that there is increasing demand as more and more people get sick, and everybody's in contact with someone that has COVID probably every day right now. Now, when you find out about it, you want to go get tested. We regularly get tested. The speed of the Delta variant has put pressure on the national supply, and the number of providers over time shrank. But I know in Louisville right now, we have 43 testing locations. Get on kycovid19.ky.gov before you simply drive to a place to try to get tested. For instance, I think CVS's in Louisville are full today, but if you look at family health centers, there are over 100 appointments for tomorrow, just for tomorrow, that you can get. We also have immediate and urgent care centers, community health centers, and others. So what I would encourage everybody to do is, we've got too much demand right now to just drive to a location and try to get it. Get online, check the locations, schedule an appointment for yourself at the earliest opportunity. You ought to be able to get one in the next day or so, and make sure, if you think you need a test, that you are wearing a mask every time you step out of your home. And I would even say, if you're worried you've had contact, that ought to be outdoor and indoor until you know. We see a lot of people waiting on a test, maybe not doing everything that they should be doing, and then they find out they're positive. So let's not be a part of that. Let's just make sure if we think that there is a chance that we've been exposed, that we do our very, very best until we hear otherwise. All right, I think that is all that we have today. Obviously, we have a number of bills coming through the General Assembly. I'm going to endeavor to take quick action, certainly on the ones that I can. I know our legislators don't want to prolong the session, and neither do I. At some point, we will get the authorities that the General Assembly is willing to give. But to those out there who might think we shouldn't have called a special session, Supreme Court said we had to. State of emergency would be over in days if we didn't. I wouldn't be able to provide workers' compensation to frontline workers that get COVID. We'd lose hundreds of doctors and nurses because we wouldn't be able to recognize their out-of-state credentials. Concern about FEMA funding that would be out there, but how would our healthcare heroes feel if I let a state of emergency in Kentucky expire while they are in the midst of all of this in their hospitals? This isn't optimal. I don't think we'll get all the tools that we need, but it was absolutely necessary. And I'm going to continue to fight as hard as I can in whatever authority I have, like we're doing in hospitals, to do the right thing, to save lives. We come too far, and in the midst of a war, you don't get to cry about what authority you do or do not have. You have to do your very best with the circumstances in front of you. Wear your mask. Get vaccinated. We can beat this. We can get through it. We can get through it together. The last thing I'm going to ask is about that Thanksgiving dinner rule where you don't talk about politics or religion unless you live in my house in which you talk about politics the whole time. But if you know someone that's not vaccinated, they're at more risk of serious illness and death than they will ever be in their lifetime. And I need your help. They ain't going to listen to me at this point, or to any real community leader at this point. They will listen to you. If it's somebody you love and care about, and you know, and they know, that you're putting your relationship on the line to have that tough conversation, that might be the only way to break through. That might be the only reason they go and get it. And I wouldn't ask you to do it if it wasn't absolutely necessary, but I don't want to see another 15-year-old, 21-year-old pass away. I don't want to see another state trooper on a ventilator. I don't want to see us losing our family members and friends. I want us to do the right thing by each other. And my faith tells me the right thing's supposed to be the hard thing. And that conversation is one that we need to have. So please, we're calling on everybody. Help us out. Help us to protect those that you love and help us to defeat this pandemic. Thank you.